Y'all, welcome to the show. Dr. Jennifer Caudle, y'all. Welcome to the show. Good morning, Dr. Jennifer.
Good morning.
So we are so happy to have you this morning. We know that you are a board-certified family physician and associate professor at Rowan University. You've been doing medical broadcasting for more than 10 years, and you reported on a variety of conditions, including the Zika virus, the flu, and now the COVID-19, the coronavirus. And we know that you appear on a whole lot of shows like Dr. Oz, Fox News, CNN, HLN, all those other shows. And so if anybody have any questions that they want to ask Dr. Caudle, you can call right now, 866-9-RICKEY. Dr. Caudle, just give everybody, because everybody's kind of panicking right now.
Yes.
So can you just let everybody know what's going on and what can they do? Because everybody in the stores is just kind of,
Yeah, no, you're right. People, everybody is on edge. And you know what? I'd be lying if I didn't tell you as a physician I wasn't a little on edge too. This is sort of a frightening time because there's so much we don't know and we're learning things literally minute by minute. But one thing I always say is that what's important is not panic, but preparedness. So all we need to do is make sure that we're prepared and doing the things that we can do. So, to your point, you're asking, so what can people actually be doing? What are we supposed to be doing right now? Well, some basic things like the hand hygiene stuff. All this hygiene stuff we need to take seriously. It's important not to blow this off. Washing our hands for 20 seconds with soap and water, or if we don't have access to soap and water to wash your hands, you can use a hand sanitizer. But it's got to be 60% alcohol and above. And honestly, guys, I'm not shaking any hands right now. And I recommend others don't either. We got to stop the hand shaking. We've got to stop the shaking of the hands during passing of the peace at church. I know many churches have cut out the hand shaking during passing of the peace, which I think is really important. You can throw up the peace sign. You can give a fist bump. Any of that stuff is fine, but no hand shaking. Super important. And
who sneezed?
By the way,
excuse me, Dr. Caudle. Dr. Caudle, stop for 1 second. Gary.
That was Brad.
We got lights on.
Brad, y'all get up. Get up and get out. I'm sorry, Dr. Caudle. Go ahead. Brad,
That was from Gary's hair flew in my nose. I'm sorry.
Go ahead, Dr. Caudle. I apologize.
God bless,
Dr. Caudle,
God bless you. Yeah.
I have a question because we want to dispel a lot of these myths. We want the facts versus the fiction. We have Instagram and social media and all these different ideas of what's going on, but we want to get to the bottom of it. So I have a question about the myths about the coronavirus. I've seen on Instagram say black people can't get it, young people can't get it. I heard that you can use vodka as hand sanitizer. I heard that the virus is man-made. What can you tell us to dispel some of these things that we think are real?
Okay, answer that question. Coming on the other side, we got to go to break right quick, so she's going to answer that question. If you have any questions, you can call 866-9-RICKEY. Dr. Jen on the Rickey Smiley Morning Show. More of your questions up next. All right, y'all, Rickey Smiley Morning Show. Listen, we got Dr. Jen. We're talking about the coronavirus. Before we went to break, you was asking Dr. Jen what?
Yeah, well, I want to know, Rickey, a lot of the facts versus fiction, because we're hearing so many reports on Instagram and people are sending us stuff on our phones. And how do we know what's true and what's not and what's just a myth? Now, some of them I've heard are kind of bizarre, such as you could use vodka as hand sanitizer. I also heard that black people can't get the coronavirus. I heard if you're a recreational smoker, you can't get coronavirus. I heard it's man-made, all these myths. So can you help us, Dr. Caudle, and let us know what, we're really dealing with?
Sure. So let me address some of the myths that you're asking about, because these are questions I'm getting too. Actually, I'm doing daily videos on my Facebook page answering questions just like these because they're floating around. My Facebook is Dr. Jen Caudle, and I'm trying to keep people updated. So a few answers to your questions. Let's start with the black people one. That's actually one I heard when I was in the beauty shop this past weekend. My hairdresser was literally talking to somebody else saying she heard someone saying that black people cannot get coronavirus, and it made me intrigued. That's a myth. Black people, we can get coronavirus, so it's a myth that we can't. And it scares me that we've been saying that we can't, because I'm concerned that we may not take as seriously some of these precautions that are being recommended. So guys, everyone out there, please understand, Black people, any person really can get coronavirus. Make sure you take proper precaution. Before the break, you asked about kids too. So it is true that kids are not affected as severely as older adults or people with certain medical conditions by coronavirus. However, kids can get coronavirus, although their symptoms may be mild. The problem with kids getting coronavirus, though, guys, is they can still transmit it to other people. So kids are just as important to keep safe as other people. Just because they don't get a severe illness doesn't mean it doesn't matter if they get it or not. So we got to keep our kids safe, too, because they can just pass it on. You asked about vodka. Oh, yeah, I'm sorry. Go ahead.
No, real quick. I wanted to ask about the explain how wearing face masks can prevent the spread of the virus.
Okay, so first of all, face masks still are not indicated for people who are not sick and who are not healthcare workers. So we're seeing lots of people running around with masks out in public. Guys, unless you're sick, you shouldn't be wearing them. The masks are for people who are already sick to try to keep them from getting others sick. And with people trying to buy up all these masks on Amazon and things like that, it's mass hysteria. Masks have been selling out, and we need them for people who really do need them. People who are cancer patients or have weakened immune systems, or for healthcare workers. So if you're healthy, you do not need to be wearing a mask general day to day.
So, Dr. Jen, people that are not wearing the mask on the planes or in public while the other people are sneezing and coughing all over the place.
Right.
Okay, wait, say that again. You said,
so the sick people aren't wearing masks. What if you're in a space where the people that are sick might not know they're sick, but they're spreading germs because they're not wearing it?
Like on an airplane.
Right. No, I totally get it. So you're saying, should you be wearing a mask in an airplane? Is that what you're asking?
Right.
Mm-hmm. So it's still not indicated to wear a mask if you are healthy. The best thing you can do is to, number one, stay away from other people. I know this is going to sound crazy, but it's really true. The word social distancing that we've been hearing is this concept of staying at least 6 feet away from other people, especially those who are sick. And that's why we keep telling people, if you're sick, you shouldn't be on a plane anyway. Stay off the plane. Stay home. That's really, really important. And stay away from others who are sick. And make sure you're washing your hands and using hand sanitizer and things like that. But guys, if we buy up all the masks and we're healthy, first of all, it doesn't protect us that much. You have to remember that those masks.
Yes, you can't tell black people to stay away from it. You have to say, black people, start acting funny. Start acting funny. In the black language, that's pretty much staying away from other people is acting funny. Let's go to the phone. Rickey Smiley Morning Show, you on with Dr. Jen. Go ahead.
My question is, if the virus has spread it and people pretty much get it, what do they need to do to actually heal themselves if they got to stay home? And also, what can we use as a sanitizer if the stores don't have it no more?
That's a great question. So if you've been diagnosed with coronavirus, okay, you do need to stay home and follow your doctor's advice. But to your question, there is no specific medication to treat coronavirus, just like we have no vaccine. So what you do is you use what we call supportive care, or these over-the-counter treatments, Tylenol, Motrin, cough suppressants. It's almost like treating a cold, okay? So that's what you would do if you've been diagnosed with coronavirus. Remember, most cases of coronavirus are mild. 80% of people will have mild to moderate symptoms, so you treat them almost like a cold. And you're asking if the stores are out of products that you can use to disinfect. I'm recommending people go to the Environmental Protection Agency. That's EPA.gov. They have a whole list of products and things you can use to disinfect and sanitize. So you may be able to use something that you didn't even think about that may be available. So go to EPA.gov to find a full list of products that are approved to disinfect coronavirus.
All right, you're on with Dr. Jen. Good morning.
If it's not essential appointments, should we even be going to doctors' offices because there's a lot of germs there too?
That's an excellent question. I literally just talked to a patient last night who called me asking for refills of her meds and asking to defer the lab slip. I'd given her a lab slip a few weeks ago, and she said, Dr. Caudle, do you mind if I hold off on getting my labs done because I'm just concerned about being out and about and going to the lab right now. She's 84 years old and has had lung cancer, et cetera. And so I'm so glad you're asking that, because what I told her was hold off. This is what I would say to you folks, honestly. If you have, if it's like a routine appointment or a physical that you can put off and hold off, yes, why not? Now, if you're sick or you've got a medical problem, you got severe medical issues, do not do that, or call your doctor to find out what they want you to do. But if it's just a routine physical, you are young and healthy and you ain't got nothing going on, and there's no particular reason to do it now versus in a month, then hold off.
Hey, thank you so much, Dr. Jen. Listen, let everybody know how they can reach you.
Absolutely. I'm doing daily videos on coronavirus on my Facebook page and on Instagram. I'm at Dr. Jen Caudle. That's
Wait a minute, you're doing daily videos, so everybody need to go and watch your videos on your Facebook page. Y'all missed that one because it's so important. So if you want information from a doctor, you have to go to the Facebook page. I didn't mean to interrupt you. I'm sorry. I got excited because I want everybody to watch your videos where they can be safe. Go ahead and give them the info again.
No. Thank you so much for encouraging that, because I'm doing daily videos. I'm posting 4 to 5 videos every day, actually answering these questions that you're asking me, because we need to know. My Facebook page is Dr. Jen Caudle, DrJenCaudle. I'm posting them on the gram as well. I'm on Twitter as well. Make sure you follow and ask me questions. I'll answer them the best I can.
All right, y'all. There it is, y'all. Rickey Smiley Morning Show. Hey, coming up next, we got Battle of the Sexes. 28 minutes before the top of the hour, Rickey Smiley Morning Show.
What's up?
Get out of bed.